It's been a policy of the Des Moines Tea Party not to have people who are running for office speak or elected politicians speak. But please excuse me. I felt that the healthcare issue was so important that I've asked Dr. David Hartsuch from the Quad Cities to speak on healthcare. He promised me that he would leave his elected position as a state senator in Iowa on the side and talk about his experience in this massive healthcare fraud. He's a graduate of the University of Minnesota. He's currently a medical doctor in an emergency unit in a hospital. He was one of the formative people back in the 90s when Minnesota was looking at a healthcare legislation. He now currently serves on a committee, Human Resources Committee, I believe, and is trying to influence people and educate people about the atrocities in this current health care legislation. So I'd like to have you welcome Dr. David Hartsuch.
What an absolutely beautiful day to be here today. And April 15th, some people call it tax day. I know better because today's a gift from God, not the IRS. You know, I like to start out talking about what kind of house would we live in if housing were free, if nobody had to pay for housing. Because everybody would say, geez, I'm going to live in a mansion. And what kind of food would you eat if all the food was free? You could just walk into the store and take it off the shelves. I don't know about you, but I'd want to be eating lobster tonight, right? But you know, it doesn't work that way. Because the funny thing is, no one would build a house for nothing, and nobody would grow or raise food for nothing. Because nothing came about except through work. And so it is that when we have politicians who guarantee to everybody all the health care they want, and it's not going to cost anybody anything to anybody. Number one, they are lying to people. And second of all, somebody has to produce those medical services that people are going to rely upon. Now, I told one of my colleagues today that I was going to be talking in front of this group, and she said, make sure you tell them about the waste that's in the emergency department, because we have that right today. I work in a little emergency department just north of Dubuque in a place called Platteville, Wisconsin, Southwest Medical Center. I don't know if anyone's from Wisconsin, but I drive up from the Quad Cities, and I work up there. And what we have, you know, I could tell you a whole bunch of stories about the foolish things that people come in for, and quite honestly, most of them shouldn't be spoken about in public. But I would like to talk about what we call the frequent flyers. Across America, in every emergency department, we know what are called frequent flyers. All right.
He's right.
Wow.
Okay. Frequent flyers come in because they don't pay anything for their health care. It's free. You just come and get it, boys. Anyhow, one example of this, the most common complaint is tooth decay. You know, people come in for tooth abscesses and bad teeth. And they come in usually wanting drugs. And we give it to them. Why? Because we're obligated to give them the care that they need. And if they come, we give it to them. They don't pay for it, so they keep coming. And they get their drugs that way. And that's why we call them frequent flyers. There's nothing we can do to stop this problem. Anyhow, had a guy come in and he had bad teeth and he wanted his drugs, and I said, well, how come you didn't go to your dentist? He said, well, he wanted $80. And I couldn't afford the $80. And I said, well, I noticed you smoke a pack per day of cigarettes at $5 a pack. How long does it take for you to save up $80 to pay the dentist? And then I noticed he had one of those brand new tattoos. You know, it's got the cellophane over it. And I said, how much did you pay for that tattoo? And he said, well, $120. And I said, well, geez, if you'd just gone to the dentist, you could have, if you could save that tattoo, you could have gone to the dentist. Anyhow, he didn't like what I had to say. I gave him drugs and sent him on his way. Now there's a nice little dentist in town, a brand new guy who really felt bad about people not getting adequate dental care. And he said, send them all to me. I will fix them for free. And I arranged this gentleman's, to him to go see this dentist for free. Well, a couple weeks later, I called that guy back, that dentist back up, and I had sent him 3 other people. And I said, how many of those people showed up? I want to hear about them. He said, not one of them showed up to get their teeth fixed. They want to keep coming to the emergency department. And when they come to the emergency department, it slows down care because it interferes from us delivering care to those people who deserve that care, who need that care. Folks, supply and demand works. It works in the medical system as well as every other commodity in our economy. If we do not allow free markets to work with supply equal demand, with the market and price mechanism at play, if patients don't have some skin in the game, the market mechanism is not allowed to function, and surprisingly what we get is deprivation in the midst of plenty. We should no longer allow politicians to be guaranteeing everything to everybody for no cost at all. It is tax day. And so I guess I would need to mention just a little bit about taxes, because if you look at the Obamacare plan, it is precisely that. It is mostly a tax bill. It taxes a whole bunch of things. Payroll taxes for not getting your insurance. Individuals may have to pay up to $10,000 for not buying their health care. It puts a 40% excise tax on high-cost plans, which would be a $10,000, $200 for an individual. Now, a lot of people might say, well, I don't pay that for my insurance. Well, after this plan is in place, you will be, and everybody will be paying that 40%. Right. There's a 10% tax on tanning booths, a 2.9% tax on medical devices. Now, I don't think you understand that. That would include stethoscopes. That would also include artificial limbs for amputees. Why would we tax artificial limbs on amputees? Now, in addition to these are what I call overt taxes, but what really burns my britches are the taxes, what I call the hidden taxes on healthcare. Hidden taxes are those things that they force you to buy that you don't want to. These include insurance mandates. Every time we put an a mandate to provide something in an insurance policy, that raises the cost of insurance, and in essence, it provides a hidden tax that everybody has to pay for. These are things that we have to get accustomed to. Yes, we need to rail against those overt taxes, but let us not forget that those hidden taxes keep people from affording the insurance care, the medical care that they need. Thanks. I can tell you that we need to turn our attention to bring more individual responsibility back into the medical marketplace. We have to encourage, once again, high deductible policies, medical health savings accounts, so that individuals are paying more of the cost, right cash on the barrel, and save the high deductibles for those people that really need it. That cuts out the third-party payers, and what I would say, more importantly, cuts out the government. We need to be concerned about what's happening in our courtroom, how our litigation, expensive litigation, is driving up the cost of health care. This is an area where the Obama plan has not even addressed that at all. And why? Because they paid off their friends. This has to change. And I know that with groups like this, it will. We have the option to either succumb to a system which promotes more dependence on the government and drives up the cost of health care, putting health care out of the reach of the average person, or we can accept a plan, a direction which has more individual self-reliance, less dependence on the government, and makes healthcare more affordable to everyone. Thank you again for this beautiful day. Thank you again for defending one of the most precious liberties, and that's our health. Thank you.